The fifth COVID-19 patient in Delta State, yesterday cried out that she is not positive of the ailment, maintaining that she was only suffering from cough, having been diagnosed of pneumonia in 2004. The patient, in an audio recording, while lamenting the poor living condition of the Warri Isolation and Treatment Center, where she is currently receiving treatment, also disclosed that she was yet to see the test result confirming that she is COVID-19 positive. Confirming the authenticity of the recording, a brother to the patient who spoke to Vanguard, said, "We are not really happy with things at the center for now, as situation there is not friendly at all. For somebody with a respiratory issue, they gave her cold water, but she demanded for hot water, so we brought hot water in a flask for her, but they refused to take it from us as well, hence we had to go back with everything we came with. She's positive," Delta government insists. "Our privacy have been invaded, 5 quarantine Delta NISC medics cry out. PSN threatens to withdraw services over incessant harassment." In the audio recording, the patient said, "I was called by the Delta State Commissioner for Health and I told him that with all due respect, sir, I need to see my test result, and besides, there are procedures by which one can contact this virus, and having been indoors, I am not a public person, though I'm a fashion designer, who did I come in contact with? There is a lockdown. Based on the symptoms of coronavirus, the person will have cough, running nose, fever and so on and so forth. But right now, the only thing I have is just cough. I did not go out during the 2 weeks lockdown and I was indoors all through. The last day to the final day of the lockdown, before it was extended, that was the day I told my younger brother that having been indoors all through, I need to stroll out, and told him to take me on a ride and drop me in my friend's house, and that was it." Contacted, the State Commissioner for Information, Mr. Charles Anagwu, insisted that the lady tested positive to coronavirus. He said the result would be printed and sent to the lady today. On allegations of poor treatment, Anagwu said that the lady was being taken good care of, contrary to her claim. "Our privacy have been invaded, 5 quarantine Delta NISC medics cry out." The 5 medical personnel currently being quarantined after coming in contact with a 5th COVID-19 patient at the Otojeremy General Hospital, Ughelli South, Delta State, have condemned the disclosure of their identities, including phone numbers, to the general public, stating that their privacy had been invaded. The medics, 3 doctors, 1 pharmacist and a medical laboratory scientist, had attended to a female patient who was last Thursday brought to the hospital after showing symptoms of the ailment. Consequently, the Ughelli South COVID-19 Monitoring, Evaluation and Enforcement Team, led by the council chairman, Dr. Richard Kofi, and company of other officials of the council, met with the hospital management and how to handle the issue. At the end of the visit, a statement allegedly authored by the media aide to the council chairman, Noah Idiamrayo, was issued, stating the findings of the team, detailing the names and addresses of the patients as well as the names and phone numbers of those being quarantined, including a sister of the pharmacist. The statement was posted on the Facebook page of the media aide to the council boss, Noah, though later deleted, claiming that his account had been deleted, while the council chairman described the allegation as a bundle of lies and falsehood. Speaking on their ordeal since being quarantined, one of the core members, who spoke on condition of anonymity, said, "We were surprised when we started getting multiple calls from strangers with our family members panicking after they also read the statement, which is already in the social media. Most surprising of it is that we heard the statement was issued by the media aide to the council chairman, who equally is a medical doctor and should know better. We hear that he is denying the statement, describing it as a bunch of lies. If actually they are, how can his aide, who is not a medic, get the exact medical diagnosis of the patient as well as her details alongside ours?